201 radio check.
The shift starts at 2 p.m.
Clear 201.
There's no telling what's in store, especially since Deputy Monem Hadari is on a trained unit.
A lot of my friends suffer from PTSD. I do have some friends who they have bipolar disorder of some sort.
That's why he volunteered to be on the Shelby County Sheriff's Crisis Intervention Team, a group trained to assist individuals going through a mental health crisis and keep it from becoming potentially dangerous.
So I was like, hey, if there's possibility, I'd like to go to this training.
40 hours worth of training.
We're responding to some challenges that are not always easy.
Conducted by Deputy Sam Cochran.
A little slow movement of your hand going up and down.
What are they learning when they take this training?
Not only about the illnesses that oftentimes are coming into crisis events, but we're also enhancing an awareness of what we refer to as de-escalation.
Memphis police and mental health providers developed the CIT program decades ago. Shelby County Sheriff Floyd Bonner says it's been a great starting point.
40 hours is just scratching the surface.
Bonner worked with the Shelby County Mayor's office to launch a new program with federal funds. Now, in addition to CIT deputies, a trained mental health professional will also respond to the crisis.
They will be on call. They'll have their own car.
Basically, the deputy's job will be securing the scene.
And then handing it off to a licensed professional individual who's trained extensively to deal with the de-escalation, the counseling piece, the connecting to service piece.
Michael Sims is with Alliance Healthcare that's providing the licensed professionals.
That service can include a referral to one of our outpatient clinics, as well as connection to housing or connection to a case manager who will help get them on disability or get them connected to insurance.
His team will also do checkups in between calls to make sure the services are being used.
911 emergency, you need fire, police, or ambulance.
The sheriff's office says about 2 to 4% of total calls are related to mental health or behavioral issues, but that's likely low. The calls are sometimes classified differently when they come in. Some studies suggest the number could be closer to 20%.
Broadcast information from 822 Deltona, mental consumer, diagnosed with paranoid schizophrenic, unknown for meds.
What's clear, the calls are among the most complex to resolve, keeping deputies from other emergencies.
There's nothing worse for a law enforcement officer to be faced with difficult challenges and difficult circumstances, and they feel like that they're not getting anywhere.
Oftentimes, deputies are called to help the same person over and over again, and their options are limited due to a lack of resources.
And they're going back, going again. And it's nowhere else to take them.
Except jail.
How is this going to change the game?
We would love to see our population go down in the jail. I said in the Memphis Crime Commission report about 25% of our detainees that come to jail are experiencing some type of mental health crisis.
Many local activists have called on law enforcement to change the way they approach mental health. They claim too many people with persistent issues wind up in jail, creating a criminal record and more problems down the road. They've pushed for innovative programs like Cahoots in Eugene, Oregon. Instead of police, a medic and crisis worker respond to the nonviolent crisis. Officials there report in 2019, officers were only called for backup 150 times out of 24,000 calls, saving taxpayers millions in ambulance trips and public safety costs.
Sheriff Bonner tells us he's been looking at those programs too, as well as pressing the state for more resources and trying to get more of his staff CIT training.
This class is so highly sought that we can never get enough officers in the classes.
Right now, we found out about 5% of correctional officers are CIT trained, 42% of deputies, and about a quarter of dispatchers. As for Hadari,
A lot of times they just need someone to talk to that understands them better.
he believes the new program will help.
To me, it's all of us working together is going to help the situation.
The afternoon we rode with him, it was calm. He hopes it's a reflection of what's to come. Jessica Gertler, WREG, News Channel 3.